Jean asks, is an annual wellness visit just a yearly physical exam?
Interesting question, Gene. And though you may see annual physical applied to the process in popular vernacular, they're not equivalent at all. And I'm not even sure that wellness visit is a good description. Uh, Possibly annual inspection or periodic health review may be better terms. Regardless, the three pillars of the annual wellness visit are: first, a health risk assessment; second, a indicated physical exam. That is to look at anything that really needs to be looked at, but not the classic head to toe unclothed physical that we were taught as part of the complete H&P while we were in training. And the third pillar is a health management plan. In the age of high value care, I think the annual wellness visit is foundational at any age. In fact, you could consider the typical well child checks to be the childhood annual wellness visits. And then what we call the annual physical through the later years, again, wellness visits. And finally, in the Medicare years, this periodic exam. Annual is a bit of an arbitrary term. The functional period really is first when you're establishing care with a new provider, and that if welcome to Medicare physical, when you're just into a new program, you get a baseline established, and then it really needs to be repeated anytime there's a change or a suspected change, or the patient's goals for any reason change. Now, the annual is inserted because it's a relatively convenient term. Many things are on an annual cycle, uh, and Medicare is really saying not so much that it should be done annually, but it won't be paid for more than once annually. Uh, and the purpose of the annual wellness visit is to identify and bring to the patient awareness any and all threats to health, and how you as the provider are proposing to manage those threats to the health. And I think with foundational characteristics of the EHR that we expect to help us in this value-based care, it's a time to make sure the lists are all accurate. Compare the problem list to the patient's recollection, the medication list, allergy list, social history that is listing all the health affecting activities and habits, and family history. Make sure those are all accurate, and listing those things that introduce a unique risk into the patient's life. Then the health management plan is an opportunity to agree on a comprehensive management plan. This is the time where if the patient has any hesitations to get routine mammography or whatever other test or treatment you're recommending, or difficulty conceptualizing keeping the blood sugar or the blood pressure under control, this is the time you explain it and get on the same page with a patient. Uh, this is where evidence-based medicine meets patient preferences and priorities. We always want to be sure uh, we manage the patient's preferences and priorities, because if we're not paying attention to them, the patient's going to force it on back onto us. Uh, the goal in value-based healthcare is to systematize that plan of care, to have this meeting between provider and physician, provider and patient, make sure you're on the same page about management plan, and then the system in place in your practice can take care of the details day by day, with knowing that the patient has agreed to these things, and until another concern or question comes up, your staff and any other automatic methods you've set up to affect the plan can just roll on without direct intervention. So I'm a believer in it. I love the annual wellness visits, and I think it can serve a strong place in everyone's practice. Thanks, Gene, for the great question.